So good evening, everyone and colleagues, and thank you, world-class business leader, for inviting me to speak here today. I'm honored to have the opportunity to speak about digital transformation and how it can be implemented in a highly regulated industry such as the pharmaceutical sector. I'm Flavia Macrì, a marketing manager with more than 10 years of experience in sales and marketing department, with a deep understanding of the healthcare sector, gained in the leading pharmaceutical industries. So let me start with a significant data. By 2025, 75% of the global workforce will be digital natives, meaning that millennials who grew up with digital innovation will actually bring it, apply it into their professional lives. So since 2025 will be here in about 400 days, it's clear that digital innovation understanding is not a nice-to-have skill, but it's more related to our professional survival. And this is true in the healthcare sector as well, where 1 out of 3 physicians will retire this decade, replaced by younger digital natives, meaning that companies, especially pharmaceutical companies, need to learn how to interact with a completely different customer than the one they are used to. So when it comes to digital transformation, for a common understanding, what I mean is the application of digital technologies into various aspects of a company processes. And it has an impact on how company operates and deliver value to its customer. And when it comes to healthcare sector, it has an impact, of course, in patient engagement and care and personalized medicine. In regulatory and compliance, for example, AI can read a text and detect if there is anything that is not, let's say, compliant with regulatory rules, and can suggest us what we need to do in order to be compliant with those rules. Then, of course, digital transformation has an impact on manufacturing and supply chain. And what is even more important to me, more interesting to me, is the impact on drug development and discovery and development and clinical trials, because a molecule development could take over 30 years. So having a sort of algorithm that can predict in advance what is going to work and in which specific population can help not only businesses, but patient lives. So digital transformation contributes, of course, to the creation of an ecosystem, omnichannel ecosystem, via several items. Data integration, because since we are operating in a digital environment, we can collect several data in order to create a personalized interaction, to be more present with our customers, creating online and offline presence, in order to enhance customer experience continuity. And last but not the least, since we are operating in a digital environment, we can measure our interaction thanks to analytics tools. So looking at all of this from the customer perspective, they are more savvy and connected than ever. They are used to interact with brands and companies. So let me share with you 3 golden rules that, in my experience, are useful for a successful omnichannel customer experience. So first of all, we need to adapt to customer preferences and be where the customer is. So according to the Customer Observatory from the 2020, from the BVA Institute, we know that telephone and emails remain the preferred channels for customers to interact with brands and companies. So the companies that will stand out are the ones that actually are able to communicate with customers in an efficient and quick way to deliver the best customer experience. Then, of course, we need to offer a seamless customer experience. We know that 60% of customers expect a consistent user experience, regardless of the time, the place, the device, and the channels they are using. And channels is an important thing to consider, because we need to, in order to offer a seamless experience, we need to be sure that all channels work in synergy. And in this scenario, it has an important role also the offline. That is a channel, actually. So we need to train our agents in order to deliver the best customer experience. And it's not easy because we know that 67% of them feel the use of digital channels as a stress factor. Then brings me to how it can be implemented in a highly regulated industry such as the pharmaceutical one. So to give you an idea, in this scenario, we have, of course, pharma company, then we have the healthcare professional, HCP, that is the decision maker, the prescriber. Then we have pharmacist, the dispenser, and then we have the end customer, that is the patient. So when it comes to drugs that need prescription, we can't communicate with patient. We can't communicate with pharmacists, as pharma company, of course, and we can only communicate with healthcare professional with selected information that must be submitted in advance to the Italian Drug Administration. So it's clear that it's a complex scenario, and we need to understand how do we navigate regulatory challenges while implementing omnichannel strategies. So I would say that we need to focus on 4 items: contents, time, channels, and engagement. When it comes to contents, it's crucial to understand customer needs in order to create a proper strategic communication and be very clear about what we want to convey. There is a model, the 3H pyramid approach, that is derived from YouTube's experience, and it was promoted by Google as a global reference framework. The 3H pyramid approach helps businesses to become more visible online, and the 3H stands clearly for hygiene, hub, and hero contents. When it comes to hygiene contents, there are pieces like how-to guide or blogs, and they are intended for the base of loyal followers in order to keep them warm. Hub contents are more sophisticated content like long articles or ebooks that are intended for occasional visitors in order to convey them, to convert them into the loyal followers base. And then we have the hero content, that are the most expensive one for companies in terms of resources and time and cost, of course, are pillar pieces like webinars or case studies that are intended for, let's say, everyone, because the objective is to acquire new target segments. So, of course, the 3H pyramid approach can help us to build a very effective editorial plan. But is this enough? I would say no, because we need to consider also the time frame. What we know is that the time that we dedicated to reading emails has decreased to 9 seconds in 2022. So it was in 2018, 13.4. It has decreasing progressively over the last few years, and it has a huge impact on how we can communicate with customers. Why is this happening? We don't know for sure, but what we know is that we used to check our emails during breaks and using mobile often. So little screen doesn't help to have a proper moment to read and reflection. In addition, we have to consider that during a typical day, an healthcare professional receives 15 notifications from scientific focus group, 15 information emails, 4 visits from reps speaking about 3 different pharmaceutical products, and at least a physician needs to deepen some information in to specific scientific portals. So, considering 8 working hours, every hour an ACP receives more than 5 stimuli. And all of this without considering its core activity, that is the patient care. Indeed, ACPs were asked about what did they do after having read the product scientific information. And you'll notice that almost 60% of them actually didn't do anything. Why? Because they are not engaged from the information they received. So the question is, the challenge is, how to be in those 4 out of 10 emails that actually engaged ACPs. So let me share with you a few tips about how can we manage these time frames issues. So in order to choose the right moment to send out communication, I would say that we need to send out them commercial information in the morning, typically from 10 to 11, and I would say from Tuesday to Thursday. So in order to stay in those 9 seconds, we need to use heterogeneous tests. So for example, bold text, highlighted text, and use CTAs and links if we want, and actually we want that our customer will look for further information. And then trying to stay in those how 10 emails that actually engage ACPs, I would say to select the information we want to share and tailor-made them. So channels, we can identify 3 categories of channels. Own media, they are property of the company, like for example, the website. Then we have paid media, like third-party vendors, that are very, very useful for company because usually they have larger database, so we can reach more customer via third-party vendor. And then we have earned media that naturally grow when one of our content goes viral. So I've seen thousands and thousands of times companies invest a lot of resources in creating brand new, fresh, attractive website. And at the end of the day, the question was how to populate them, not in terms of content, but in terms of audiences, target customers. That's why I want to make a little test with you. And I would like you picture yourself during your crazy busy week, keeping up with all your to-do lists, duties, and then you have to remember the password and that username to log in the website where there is an information that actually you don't feel you need to learn to know, because actually it's the company that wants to communicate with you, not the opposite. How do you feel? A little stressed? Then picture yourself in a completely different scenario. You are laying on a sofa in your relaxing time, scrolling on your favorite social media, and then you bump into that information about that product. It's something that you already heard about, but now you feel like curious, proactive in looking for this information. You want to know more. There is where we want to be. There is where the magic happens. There is where we can switch from the push communication to the pull communication. And this is true in the healthcare sector as well. You can see a graph taken from Twitter showing how healthcare posts increased over the last few years, meaning that there is a need, but also an answer in a pret-a-porter information also in a highly scientific and educated sector such as the healthcare one. This let a new figure emerge, the digital opinion leader, DOL. Who is a digital opinion leader? Someone that influences online, typically on social media. There's no expectation she is on traditional media, and he can influence globally. So as soon as they are respected, as long as they are respected from their peers, doesn't matter their level of seniority. What is important is that they can interact in real time with any kind of information. Like, for example, a data is published, they can reply to the post and put a statement that become a benchmark at global level. So it's crucial for companies, especially for pharma company, understand how to create a digital opinion leader engagement plan. First of all, okay, we are operating in a digital environment, but we're still human beings, so we need to invest in the relationship. Second, we need to know the digital preferences of our DOL and act accordingly with them. And last but not the least, the big opportunity to measure our action and interaction in order to improve them in a test-and-learn approach. So here you have a very, very practical example of an event journey we made in my company, Amarin Corporation. I don't want to navigate with you all the single items of this slide. I just want to highlight 3 factors that can be exported also in other industries. The first one is that by creating an event journey, we managed to convert a one-day event into a journey that lasts up 4 months, meaning that in this way we can maximize resources, time, people, and so on and so forth. The second thing that I want to highlight is that in this journey, we activated 14 channels. So the number is relative. What is important is that as soon as we activate several channels, we need to be sure that all of them work in synergy, meaning that they need to speak about the same topic, of course, customized in terms of format. Last but not the least, my mantra is be where your customer is. In the reach and activation phase, we started from where we know our customer was, digitally and physically speaking. And then we move them, we convert them into the convert engage phase, bringing them into our own media, so for example, the website. So when it comes to future trends in digital innovation, it's crucial to keep in mind that digital escapes evolve rapidly, and many trends new emerge while the SDC1 may evolve in unexpected ways. So in my opinion, I would like to share with you 2 trends that is gaining momentum for pharmaceutical industry in the context of 2024. The first one is data-driven marketing. Indeed, even in a highly regulated industry such as the pharmaceutical sector, we can leverage on data in order to create the best customer experience, not only for physician, but also for patient. And then metaverse, thinking about augmented reality, virtual reality, so very immersive environment where we can experience a new way of working and collaborate and education, let's say. So this is even more important in the healthcare sector where being accurate and update has an impact on patient lives. So in conclusion, I would like to finish with 3 take-home messages. The first one is ruling digital innovation and omnichannel strategy is an urgency, is not an option. The second is orchestrate contents, time, channel, and engagement to create a successful omnichannel strategy is a must to be competitive, to still competitive. And last but not the least, find your digital opinion leader and be where your customer is. Thank you.